And it is South Africa tonight. Now, panic buying has set in. I'm sure you've been reading about that all day. Groceries like sanitizer and toilet paper are flying off the shelves at several supermarkets. But is this behavior rational? Let's bring in clinical psychologist Cassandra Governor joining us via Skype this evening. Cassandra, good evening and thanks so much for your time. So what is the mentality that we're witnessing here? What are we seeing? What is the psychology behind this kind of behavior, such as panic buying?
Sure, thanks for having me. Well, I think we are hardwired to respond to situations of threat. So I think it's in our DNA. Like, for example, if you have to put your hand on something hot, you automatically move it away without even telling your brain to do anything. So we're programmed to deal with issues of threat. But obviously, as the threat is newer and more serious, we respond in different kinds of fear behavior. And stockpiling, which we then displace in different types of behaviors, can be one example. But I think what's so interesting about the stockpiling happening around coronavirus is it's not just survival things that people are stockpiling. They're also stockpiling luxury things like toilet paper. You know, toilet paper is not typically an emergency response like medication or sanitizer would be. So it's a suggestion that people's fear responses are not just about survival, but also about feeling out of control, perhaps, and not knowing what's going to come next.
I mean, could this be about the language around coronavirus? And like, say, for example, we have the president now calling this a national emergency. We have the health minister saying that the spread of the virus is explosive. Could language and terms like that also be what's goading people on to go out and panic buy like this?
Completely. So I think if you walk into Checkers and all these shelves are empty, I think it also sparks in you a feeling of, oh no, I better start buying things, otherwise nothing's going to be left.
And we also see people becoming very, very selfish and you know, just not thinking about their fellow human beings who might need these supplies. I mean, surely, what is the person's thought process when they're doing this? Is it complete detachment from the human race?
Well, I mean, it's an interesting question, and what I was actually going to say next, which is it's obviously very dangerous behavior, because it means when you're stockpiling things like medication, sanitizer, even masks, it's really dangerous for those in immediate need who might not have access to it because the general public stockpiled it, as well as the people who are on the front lines trying to treat all of this. But I don't think it's more a detachment or more of a conscious selfishness, but more a self-preservation and an absolute frenzy, to be honest. It's not thinking. When we panic, when we are afraid, our vision narrows in, and all we can think about is, how do I save myself? How do I protect myself from threat? And that's how people respond, in this fight or flight kind of way. And that is sort of what's happening here with all of this panic buying.
I mean, you know, what's the worst that can happen here if this kind of behavior actually continues? What are we going to see happening?
Well, one thing you pointed out, which is really important, it means that some people are going to be sitting with hordes and loads of sanitizer, food stocks, those kind of things, but some people are going to go without, because it's then going to mean we have an unequal distribution. But most importantly, the worst thing that can happen is that the people who are actually sick and the people who do need to prevent transmission, the most important people, might not have access to the supplies that they need in order to stop things from going any further. And they may also die because they haven't accessed the right kind of things, and we've now continue to spread the disease. Well,
Cassandra, what would be your advice to any ordinary South African now who is watching these stats? They're listening to the speeches, they're watching the updates as well. I mean, yes, we know that cases are growing. We know that the nature of cases and the nature of transmission as well is changing. It's not just people who have traveled now. We are waiting for confirmation. What would be your advice to people as to how to filter the information and how to process that and apply it to themselves?
So I think the first thing is to acknowledge that it is frightening, and it's okay that people are scared. We just don't need to panic. So to contextualize that what people are feeling is normal, but how we respond to that is what we can control. So if people are feeling very out of control and scared and worried, I think it's better to channel that worry into constructive means of dealing with it. There are a lot of things we can do to regain agency, a lot of precautionary measures like watching your hygiene, self-quarantine when you should, taking an active role in ensuring that you don't prevent or prolong this disease by taking responsibility for what you're doing. So I think one way is to reestablish control and handle what you can handle.
Okay, so sensible advice. Let's keep our wits about us and think about our fellow human beings. Thanks so much. There's psychologist Cassandra Govender.